Now is my turn to invite Dr. Sudharshan Ballal, Chairman, Manipal Health, for his talk. Dr. Ballal.
Dr. Gyani, Mr. Gupta, distinguished faculty, ladies and gentlemen. It's indeed a great pleasure and honor for me to be here. At the outset, I would like to thank the organizers, my good friend Dr. Nagen Swami in particular, for giving me this opportunity to be here. I certainly don't claim to be an expert in quality, but as the saying goes, if you are surrounded by something, you imbibe some of the qualities by pure osmosis. And I'm surrounded by quality. Dr. Nagen Swami, Dr. Murli, Dr. Malti in the past, and of course our distinguished chair people here, who are the epitome of quality, and Dr. Gyani in particular, who introduced quality to India. So I'm really glad to be here. Without further ado, I'll move on to what we have to say. The clinician's perspective of quality. Next, please. What I would like to do in the next 15 or 20 minutes allocated to me is give my perspective of what is quality, the healthcare quality scenario in India, top priorities of quality care, briefly about standardizations and accreditations, benefits of accreditation, and speak a little bit about what is the barriers to quality of care in our country, personal thoughts about what a high quality doctor should be, even though it may not totally fit into the true role of quality in this, and finally conclude about what I had to say. It's very interesting. I was not much of a quality fan when I started my career. I thought this is something people just talk about. If I take good care of my patients, that's all that's needed. I really don't need to worry about quality. And then, of course, I told you I was surrounded by people who were sort of into quality all the time, and I slowly started thinking that maybe there is some role for quality in healthcare. And then my life-changing moment was a few years ago when I went to 4 different cities in a matter of 1 week, visited 4 different hospitals and 4 different fast food chains. And what was striking to me is every KFC and every McDonald's I visited in each and every city was the same. If I had my eyes closed, I wouldn't know whether I was in Singapore, Mumbai, Bangalore, or Bangkok. Because the services were the same, the branding was the same, the quality of food was the same, except, of course, the persons did vary from place to place. Maybe the accent changed based on which city you are. Then I visited 4 hospitals, famous hospitals in these 4 cities, and every hospital was different. Not only was the hospital different, each doctor was different, the way he spoke to the patients was different, each floor was different, each OPD was different. That means we have failed miserably in having standardization. Thanks to NABH and many other quality organizations that have come up now, things are slowly changing, and more importantly, patients now are demanding standardization of care in our healthcare system. What is quality? I think there are numerous definitions of quality. I will not go into all these definitions, which are fairly standard. But to me, quality in healthcare is getting the right care to the right patient at the right time, every time. And that is important. Quality obviously lies in the eyes of the beholder. And this to me is quality, and Devi has already mentioned about what the patient's demands are and how we should go all out to make sure the patient is safe in the environment of the hospital, because I believe you're 2,000 times more likely to die if you're admitted to a hospital than walking the streets of East St. Louis, which was the highest crime area in the world. So hospitals are dangerous places to be in, as has been adequately mentioned earlier. So let's look at the history of what has happened to quality in the healthcare system. 1980s, when most of us sort of graduated, did our post-graduation and started practicing medicine. And the quality management system at that time, healthcare does not need it, was the opinion of most people, more of an industrial requirement, and accreditation, most people didn't know what it is and why it was needed. In the 1990s, it became a fad for a few. People said, let us try it, no harm done. Again, accreditation started but was not so relevant. However, now it's a useful tool and it's a must for a well-run organization and a good marketing gimmick too. It is required urgently, and the red alert has been sounded Every day there are calls from different organizations saying that we want NABH accreditation. How do we go about doing this? I think the top priorities of quality care should be patient safety, standardization of care, and quality of management. There are numerous quality accreditation services now. You know about the ISO, NABH, JCI, and we have experts in this audience who are the gurus of this accreditation and quality programs. So it would be unfair for me to say that. It would be like carrying coal to Newcastle. So what are the benefits of an accreditation of a given healthcare system? The benefits could be to the patients, which means they'll have continuity of care and most importantly, a safe stay in the hospital. Of course, something that's coming up repeatedly now is pain management. And we have introduced the concept of a pain-free hospital as far as possible for every patient in the healthcare system. Patient satisfaction is to be evaluated so that we get good feedbacks and act on it. Rights are respected and protected. In the olden days, patients had no rights. And I think in the future, all the rights will be the patients and the doctors won't have any rights. So I think we are slowly moving in that direction. Access to quality focused organization, credentialing and privileging, I think is becoming an absolute must in most organizations. And we need to deliver high quality of care. And there is a need for understandable education and communication. There's also significant benefit to the staff. The quality is not just for the patients alone. There's significant benefit to the staff, which improves their professional staff development, provides education on consensus standards, provides leadership for quality improvement, increases satisfaction with continuous learning, good working environment, leadership and ownership. There's certainly benefits to the hospital too, improves care, stimulates continuous improvement, demonstrates commitment to quality care, raises community confidence, and an opportunity to benchmark with the best. And in the future, I don't think any hospital can function without being accredited. What are the barriers to quality care? Why did we wake up so late when the airline industry and others woke up decades ago? The reason being, the biggest barrier in my mind is the mindset of the medical fraternity and the hospital administration, which fortunately is changing now. People thought quality was not important. They thought quality is just something that people talk about. It's not necessary for us. As long as we have good doctors and nursing, we don't need to do anything more. The other barriers are lack of reliable and comparable data, lack of automated information systems, which fortunately is again changing, inadequate resource allocation, lack of organizational and system support. And this, I think, is very, very important. Who's the quality person? In the past, it was the junior most person who has joined the hospital. On day one, he was introduced to the hospital. Day two, he was made in charge of quality. That was the kind of importance people gave to quality. And finance department didn't know which department quality was, and there was no allocation of any finances. Now, I think things are changing. It is so important that one of the most important persons in our organization now heads our quality, which is Dr. Swami. That is the kind of importance organizations now require so that quality can be something that's absolutely, absolutely driven from the top. The concepts of quality are defined and specific quality policies and objectives are there. It should have a strong customer orientation and it should widely integrate the organizational activity. We have to plan. What is planned needs to be done. What we do, we need to check and act on if there's any deficiency. And this cycle should go on. Only then will quality be a continuous process. I want to share a few of my thoughts about a high quality doctor because I think what's happening now is that we are losing our importance and also the importance of being a good doctor because patients do not respect us. The society doesn't respect the doctors as much as they used to. When we were growing up, most doctors like Dr. Nandakumar Jairam would walk around with a halo. The halo is completely gone in most cases now, or half gone in many of them. And to me, that is very important to restore this. And to me, the quality of a high quality doctor is compassion, empathy, and people skills. It is not just your surgical or your professional skills. Clinical excellence obviously needed. You should be apolitical, non-communal, and unbiased. Doctors cannot take stands. Leadership skills absolutely necessary. Most importantly, something that's a dying field now, which is the ethical practice of medicine, and we have to have some social responsibilities. The other thing that has been a major casualty in the recent past is the sacred patient-doctor relationship, which is dead and gone. It should be based on trust, confidence, and respect. And the reasons for the decline is partly within us. One is the huge increase in the cost of treatment makes people very suspicious of us. And misconceptions of what constitutes negligence. Any poor outcome is construed as negligence rather than a known complication of the disease. Unfortunately, a lot of corruption and unethical practices have creeped in this competitive world. There are, of course, some which are totally lawless behavior for extortion alone, and the media coverage is a double-edged sword. They could be useful, but most of the times, I think they sensationalize the matters, which becomes a problem for both the patient and for the doctor. And the mantra for revival of the patient-doctor relationship is, one, be a compassionate doctor who empathizes with the patient, inculcate excellent people and soft skills, be honest, transparent, and ethical. Frequent communication and documentation is very, very essential. We talk to people, but we don't document. And I think it's very, very necessary to have frequent communications with the patient and the family. And most importantly, it's always important to have a good financial counselor so that the patients know what to expect and what not to expect. Actively involve the patient and the family in the care of the patient and plan it accordingly. Very, very important. I think we should let go of our egos and offer a second opinion wherever there's a difficult case so that the patients feel we're not hiding anything. We should work with the media in creating more awareness. And of course, the medical fraternity, regulatory authority, and the insurance company should work together in these fields. In conclusion, as a clinician, my perspective is that quality means making sure that the most important person in the healthcare industry, which is the patient, gets the right care in a safe environment at the right time, every time, whoever the healthcare giver is. Whether it is KFC in India, US, UK, or Singapore, it should all be the same. So also every hospital in any part of this world should have the same level of care, same standardization, same processes. Ladies and gentlemen, quality is here to stay, and patients will reject us if we don't demonstrate to them our capability to deliver quality, standardized healthcare to them in the future. Thank you very much. You'll never be a good doctor unless you're a good human being. That's my parting message. Thank you.
Thank you very much, Dr. Ballal. I think we'll take one or two questions maybe after Dr. Nandkumar, because they jointly, you will be here till 10:30.
Yes, yes.
Yeah, I think we'll
Sure.
then.
Thank you very much.
Thank you.